Hi, this is Ben Cohen, an Employee Benefits Relationship Manager at Rose Street Advisors. Today we're going to be talking about self-funded health plans with our RSA University. Let's learn more. Today we're going to be talking about self-funded health plan basics. Let's get started. So what is a self-funded health plan? In most cases, the employer pays claims and takes most of the financial risk for those claims costs rather than paying a flat premium to an insurance company. The employer contracts each of the components of a benefit plan, sometimes with one administrator or sometimes an insurance carrier. And those components include, but are not limited to, a third-party administrator or TPA for claims payment, customer service, coordination, etc., a network of providers for the employees to access, a pharmacy benefit manager or PBM, as well as a stop-loss insurance carrier for large insurance claims. Some of the common terms and definitions that apply to self-funded health plans include a TPA, or third-party administrator. This is an organization that manages the claims payment, coordinates between the different partners, provides customer service, etc. There's also a network of providers. This contracts with different medical providers to provide a network of hospitals and physicians at various negotiated discounts. Next, we have a pharmacy benefit manager, or PBM. This provides prescription drug services, including a list of approved drugs or a formulary, a network of pharmacies, mail order services, outsourcing, etc. And then lastly is stop-loss insurance. This provides insurance protection for large claims. It's paid on a per-contract basis. And two examples of this are a specific stop-loss coverage. This is insurance coverage per contract or employee family unit. For example, $150,000 per contract for specific stop-loss. And the second type is aggregate stop-loss. This is insurance coverage for the group as a whole. For example, this might max out at $1,500 per contract per month or $2 million per year as the most that an employer would pay for healthcare coverage. What are some of the reasons an employer might choose a self-funded plan? They include the flexibility in the plan design and administration of services, the ability to choose best-in-class service providers to provide those services to employees. They often have lower fixed costs than fully insured plans. But along with that comes a willingness to accept additional financial risk in the form of higher than expected claims for the advantage of realizing the potential savings in a year that you have lower than expected claims. You also have the ability to determine the level of risk or stop-loss levels that you as an employer is interested in. There are less and/or different regulations that apply to self-funded plans than fully insured plans. There are also lower taxes that apply, and it can improve cash flow, but at less regular basis than a fully insured plan. Some of the types of self-funded plans that we encounter at the very simplest level are a fully insured plan with a WRAP HRA or health reimbursement arrangement. This gives you a soft entry into this world. We also have level funded plans that cap how much an employer needs to pay each month of claims expenses. Captives provide a level of protection that bundles you with other like-minded employers to share the risk. Partially self-funded provides you with a specific stop-loss like we talked about, as well as that aggregate stop-loss. And then all the way to fully self-funded, meaning there is no specific stop-loss, there is no aggregate stop-loss. Very large employers might self-fund the entire program. As always, I want to thank you for your time and offer that if you have any questions, to please contact your relationship manager at Rose Street Advisors or contact us directly at info@rosestreetadvisors.com or 269-552-3200. Thank you.